Thank you so much. My name is Natalie Mehra. I'm the Executive Director of the Ontario Health Coalition, and we're here today because the next small and rural hospital, the one in the town of Durham, which is in the county of Grey, Ontario, is at risk of really a fatal blow. The plan is now to close all of their inpatient beds, all the remaining inpatient beds, move them to Walkerton and Kincardine. The hospital corporation, which is one of the amalgamated hospital corporations, the board is not elected by the community and not accountable to the community, has made this decision without any community input whatsoever. And in fact, just a few weeks ago, made their decision public. It mirrors almost to the date what happened in Minden last year this time, where the community was blindsided, the municipalities blindsided with an announced closure that ended their hospital, resulted in the taking down of the H and the closure of their hospital as a hospital. Their hospital had been built in 1956. The Durham Hospital dates back to 1910. I'm here to announce the ratcheting up of the fight back to stop this closure. This closure heralds a new and heightened risk to the remaining small and rural and local hospitals across the province that have been facing unprecedented closures of services. And I'm just going to open with Mayor Kevin Eccles, who's going to tell you about what the municipality is doing.
It's afternoon. That's right, it's past noon now. Good afternoon, everybody out there, and thank you, Natalie, for that, of explaining where we're at. The municipality, as Natalie said, was informed April 25th that due to staffing shortages, according to the board, that they were going to remove the 10 inpatient beds, transition, wasn't really removing, they were going to transition those beds to, as Natalie said, Walkerton and Kincardine. At that point, it was about exactly 45 days when we had been blindsided with the idea that our emergency care was going to be down to 12 hours a day. Bit of an oxymoron when you consider that they said it's going to be from 7 till 5, and that's 12. 10 hours a day. I think a number of people have already said it. We're down to banker's hours on our emergency care. And that was because of staffing shortages, and we were going to be able to keep the hospital operating and whatnot, and that would keep our emergency care. Here we were 45 days later. We've still got problems. What we have planned to do won't work, and now we're going to take the inpatient beds and transition them. It has been very disturbing how this has happened. We have a ministry that is regulated to supply health care to all of Ontario. And here we are attacking what I call attacking rural Ontario and northern Ontario to concentrate this. The hospitals themselves were built in rural Ontario for a reason, for a very good reason, to be able to connect people to the care that they're required to have. And now all of a sudden we have a ministry that is saying, no, it's local decisions with local input that this is why we're closing some of these rural hospitals. In our case, and I can't I certainly can't speak for Minden, but I can certainly speak for the town of Durham and the residents in West Grey. There was no local input. We were just blindsided by this. So the ministry has a mandate to supply, and yet here we are with a board that they have put into place and whatnot that's randomly, from their explanation, doing whatever they want, off beat, off schedule, in our mind. But I'm realizing that that's not the case here. The ministry must know what's going on. And if they don't, then they must do an investigation on this board, why it's gone so rogue in supplying rural Ontario with the health care, Northern Ontario with the health care that they deserve and need and require. We have been, since April 25th, the municipality has stepped forward and said we're going to try and do everything that we possibly can to make the board and the CEO of South Bruce Grey Health Centre recognize that they're making a mistake here, and also making the ministry available that we need consultation. There are ways to keep these hospitals open, but we've hit a wall. So at this point in time, we've hired some very large urban lawyer group that is representing us, and I'm here to say that probably in the next 48 hours, that it seems like this is all that we're going to be able to, how we're going to be able to negotiate. Certainly not a way that we want to, or are going to be required to, or want and need to, but here we are. We'll go at it and we'll attack it, because we've tried everything we can about negotiation, conversation. That's not working, so now we're going to go the legal route. And that's what I'm here to announce today, that that's going to happen. With, I hope, the County of Grey and the support of the individuals that are here at the podium with me today as well, too. It's sad that we've come to this, that in a democracy we can't have open and free speech and be able to put things forward to resolve our issues for our community. But, as I said, here we are, and this is the avenue we've got to take, I've got to take, Council of West Grey has to take, to protect our community and our citizens and deliver one of the most substantial things that being an Ontarian person, being a West Grey person, being a Canadian, of access to health care. Thank you for listening today, and I think that we have a few other people, Natalie, that would like to give their information out here as well, too. Thank you.
Thank you. So that's Mayor Kevin Eccles from West Grey, the municipality of West Grey. And now we have Erin Ariss. She's a registered nurse herself and the president of the Ontario Nurses Association.
Thank you, Natalie. Good afternoon. I am Erin Ariss. I'm a registered nurse and the president of the Ontario Nurses Association. ONA is Canada's largest nurses union, representing over 68,000 registered nurses and healthcare professionals in Ontario and 18,000 nursing student affiliates. I'm here today because we are proud to be part of the movement to save Durham Hospital. The number of times nurses and healthcare professionals have had to come to Queen's Park to voice our concerns about the Ford government's healthcare policies over the last 6 months must be noted, and should be deeply concerning to all Ontarians. From privatization of healthcare to understaffing to ER closures across Ontario, our healthcare system is in crisis. And here we are, again, to oppose the permanent closure of inpatient and ER beds at Durham Hospital. Local hospitals serve as the cornerstone of communities, and they always have been cornerstones of communities. Their role extends far beyond just medical treatment. Their presence indicates a sense of security and trust within the community. As an ER nurse, I can tell you that minutes save lives. The closures of local hospitals will result in community members having to travel farther to access care. This fight is about access to public care when you need it. Residents of small communities such as Durham deserve the best care, comparable to what patients, what residents, what clients receive in large urban areas. And I can tell you that nurses and healthcare professionals want to work in the communities where they live. They care and are deeply invested in their communities. The key to this is a key, a factor to recruitment and retention in rural areas. Last year, Minden Hospital was closed, as the Mayor mentioned, and urgent care centres in Fort Erie and Port Colborne were closed overnight. The Ford government refused to intervene and used excuses to negate its responsibilities, calling this a local board's decision, and this should sound familiar. We saw residents of Minden come to this house, their house, to tell Ford and Jones otherwise. Still, this government chose not to listen to community members and healthcare professionals who wanted to receive care closer to home and to work in their communities. And they are doing it again in Durham this year. Announcement like this, made a few weeks just before the session adjourns for December, clearly indicates how this government avoids public accountability. So our message is clear. Where there is a will, there is a way. This government can issue a moratorium on the closure and meet the residents and the local board to discuss the challenges straining hospitals. And they can do this transparently and honestly. Ford government can fully fund and commit to providing ERs with the funding to remain open across the province. The Ministry of Health, Hospital Management, and the board must go beyond simply posting a job. We need robust solutions to reverse this closure and prevent others. Our members have repeatedly offered solutions for retention and recruitment to keep ERs open in local hospitals. For example, hospital management in other hospitals such as Windsor have offered incentives such as signing bonuses. The long and short of it is, Ontarians demand transparency. Ontarians demand that they be consulted for decisions that impact them, and it is never too late to do the right thing. ONA calls on this government to issue a moratorium on all hospital closures and urges the government to listen to the voices of community members, frontline nurses, and healthcare professionals who want to save lives by saving their local hospitals. Thank you.
Thank you. And now we've got JP Hornick, and JP is the president of OPSEU.
Good afternoon. OPSEU represents more than 180,000 workers, including 60,000 healthcare workers in every corner of this province. It's disturbing, as Erin has noted, to be here once again, sounding the alarm as we see a community hospital under threat. We've seen this play out in other communities, like Minden, and it is avoidable and unnecessary. The writing is on the wall. Gutting the services that are delivered at Durham Hospital, including cuts to emergency department hours and the closure of all inpatient beds, will make it unviable. We know that this is a plan to close it altogether. The community has been blindsided by poor leadership and political decisions at the provincial level. It's not just frontline healthcare jobs that are on the line. These decisions, and these are choices, put lives at risk and harm patient care, especially in rural communities. Timely access to medical care is a right. Residents, patients, and workers shouldn't suffer because of gross mismanagement on the part of this provincial government. The hospital leadership's inability to maintain adequate staffing levels shouldn't come at a cost to quality patient care. And their staffing crisis is not unique. We see it throughout the healthcare system, we see it in every corner of the province, and it is directly due to conservative underfunding. It is Ford's failed leadership when it comes to our healthcare system that has seen hospital after hospital in crisis and rural communities targeted. What's happening at the Durham Hospital is just the latest example of the Ford government ignoring the needs of local communities just as they ignore the needs of frontline and dedicated workers. So let's be clear. It is a political choice to systematically undermine our public hospitals. It is a choice to pay private clinics 3 times as much to deliver the same services as our public hospitals currently deliver. It is a choice to rely on private nursing agencies. It is a choice to make our healthcare system one that is fueled by the pursuit of profit rather than the quality of care. Patients in our communities will suffer the consequences of these choices. Residents shouldn't have to fight to protect their access to the healthcare services that they need. But we are proud to stand with them as we do, and we are proud to stand with our fellow frontline workers and patient advocates who are fighting back. And I say this now, we will win. It is time for the hospital leadership and for Premier Ford to listen to community residents and frontline workers. It is not too late to reverse the cuts to Durham Hospital services now. And our message for the Premier is to pay attention to the crisis emerging in our hospitals in this province, to the crisis in our rural hospitals in particular, and to take steps to stop it before there are none left. Thank you.
Thank you. Thanks very much. So just to close, if really there are two levels of responsibility here and of governance that could actually stop this: the local hospital board and the Ford government, the Minister of Health. It is a political choice not to do so. If one were to listen to them, you would hear kind of a collective clutching of pearls, oohing and awing, lip service to caring about the services, and then all kinds of excuses as to why it would be impossible to maintain these hospital services. And yet, why is it that other small rural and local hospitals in Ontario are not facing closures of all of their inpatient beds or their entire emergency department or their emergency department permanently at night? Why is it that only these amalgamated hospitals that have for years wanted to close down the smaller sites are now moving ahead and doing it with, let's face it, the blessing of the Ford government disguised as a shrugging off of responsibility? The bottom line is that I've done this for 27 years at the leadership of the Ontario Health Coalition. We've successfully fought off the closure of dozens and dozens of major local services and entire local hospitals. The minister intervened to stop the closure of the Welland Hospital. The minister intervened to stop the closure of the Wallaceburg Emergency Department, to stop the closure of Midlands ICU, to stop the closure of St. Joe Island Emergency Department, to stop the closure of the thoracic cancer surgery in Windsor, I could just name dozens and dozens of cases in which former ministers have intervened. There has been no government, in my experience, in the modern history of public hospitals that has ever claimed that it is not their responsibility whether an entire community hospital closes. This hospital was founded in 1910. It belongs to the community. The community supported it through 2 world wars, a Great Depression, multiple economic recessions, good times and bad, through multiple hospital boards and many, many iterations of provincial governments. And that hospital has survived. And we are to believe that now in 2024, suddenly it's impossible to staff these hospitals. It's ludicrous. The claims are ludicrous. In fact, this government has funded out other small and rural hospitals that were facing major deficits and new significant costs as a result of having to use staffing agencies. So why not here? Why is it when the local hospital board, which is no longer elected, those amalgamated hospital boards have become self-appointing? No one in the community, actually, they have to apply for membership. The board chooses the members and then the members elect the board. It's a self-perpetuating level of governance, even though the minister doesn't seem to understand that. There is no democracy anymore in these hospitals, and there really should be, because they're accountable to no one. When you look at what's happening in Durham, in Chesley next door, where the emergency department has now been closed for years at night and often in the daytime as well, and is at imminent risk of closure, and you look at nearby Hanover, where all the patients go, even though they want to centralize the services and resources to Walkerton and Kincardine, leaving the patients going to Hanover, a completely overwhelmed hospital without the resources to provide for them. This minister is either the most incompetent minister we have ever seen in my experience, and I don't say that lightly, or they're doing it on purpose. And if it's not on purpose, then they have to answer for why is it that they increased global funding for hospitals at only 0.5% last year, but increased the funding for private clinics at 212%, and the funding for the Don Mills Private Hospital at 278%. Why is it that they're depriving hospitals of those resources? Why is it that they appealed Bill 124 when they know that the staffing crisis has been worsened by it? Why is it that they are not setting a policy of moratorium on hospital closures, requiring local boards to at least try to maintain these services that communities have spent a century building? The provincial government is responsible for setting the standards. The local hospital board should be responsive to local communities, should consult with them for real, should represent their real healthcare needs, and not the desires to centralize services or empire build in certain sites at the expense of others. And so we're calling for a moratorium on these hospital closures. We're calling for the Ford government to take this seriously. And at this point, I have to say, there is no one in rural Ontario who should ever vote for this government again unless they fundamentally change direction on healthcare policy. And with that, if I sound angry, I am. We're very worried now. We're looking at, imminent closures of a number of hospitals across the province that took really generations to build. So any questions?
Yeah, to clarify to the mayor, when you say legal route, what exactly do you mean by that? It's just a lawsuit, or what is it?
Yes.
Okay.
Yes, it's going to be, there will be a suit filed with the courts here, as I said, in 48 hours.
And, the premier called out the mayor of Windsor for doing a petition, and she was, offering Chinese prices like an Apple Watch, this kind of thing. Did the premier comments in any way refrain you from taking a similar approach, or is that something you never considered?
We did a petition, as you said. We were here last week when it was presented, and I thank MPP Shamji and MPP Jelena for reading it in. Basically, it was about 48 hours we had in a town of 2,500. We had 3,700 signatures on that. That gives you the idea of the involvement. Our local MPP, who is a conservative and sits on the other side of the legislature, refused to read it in. So I'm taking it that must have come from someplace high above that he shouldn't do that.
And again, when you came last week to the legislature, so just to clarify, you didn't land any meetings with the Ministry of Health at that time?
No. We delivered quite a few hundreds of personally signed and written letters to the Premier's office and to the Minister's office at the door. That was as close as we could get to the Minister.
Mayor, could you expand a bit on what the legal grounds, what the nature of the suit is? Is it a judicial review of the decision, or what's the legal basis for it?
When we get into that legal part, that's why we hired lawyers.
Yeah.
It is basically putting the pressure on the board and the ministry to the minister to take a look at the legal aspect of what the board has done, and that's about as far as I can go with it. That does the board have the right and the rights to do, and are they acting within their own charter? Have they stepped way out and beyond of what they are, and have the legal aspect on that, the legal decision on that case?
When it's going to be filed in the next
48 hours.
So a copy of that could be procured.
Once it's filed, it'll be a public document. Yes.
Can you say a bit more about how long people have to travel if now that the ER has limited hours, or if it were to close? So I mean, Natalie mentioned Hanover. As you know, I know the area.
Yes.
Walkerton's not that far away. So how much does it affect people? You've got a sick kid in the middle of the night. How much farther would you have to go? Is there a way you can quantify that?
Individuals, and as you may be aware of, and for anybody out there that's not, rural Ontario has strategically placed hospitals. It does look like they may be in close proximity, but as you said, in the middle of the night, in the middle of February, from Durham, and somebody, in and around Durham in the rural area, from their rural residence and or farm, whatever it may be, it'll be at least for them to drive in. It'll be another 20-25 minutes to be able to get from where they are in, and then recognizing that the hospital in Durham is not open at this point in time, and then having to travel. The closest would be Hanover from Durham Central, is 20 kilometers. Walkerton is another 10 kilometers beyond that. And if they do want one of those beds that seems to be removed from Durham to get to Kincardine, it's about 78 kilometers.
Can I just mention something, though? There's a helipad, too, at your hospital, and
Yes.
It's one of the few helipads in the area, and I actually don't understand the decision-making around the emergency department for that reason. But in addition, there's not one iota of extra hospital capacity, not through any of the region. So closing emergency departments, closing inpatient beds, and so on, I mean, there's no extra capacity, not in Kincardine, not in Walkerton, not in Hanover, not in Chesley, not in Durham. So, I mean, the idea of actually reducing, shutting down, shifting beds that we know will, ultimately not exist or what have you, is just a travesty. I mean, there's just no extra services.
There's 10 beds at the Durham Hospital we're talking about?
10 inpatient beds at the present moment, yes.
And the plan would be that those would be, on paper, those would be shifted to Kincardine?
5 of them will be transitioned. I got to use the wording that they use. Transition to Kincardine, and 5 to transition to Walkerton. What I understand is by using the word transition, that doesn't get into the point. The ministry, it is in the ministry. If those beds were to be moved and closed, then the regulation does stipulate absolutely the minister has to step in and approve that. But by using the word transition indefinitely, the board, I believe, has overstepped and using just strange language to be able to explain what they're doing.
And the solution to this that's been mentioned, Natalie and some others have mentioned this, would be essentially more money to hire. You need to pay people more in order to attract staff. We're short staffed, so we need more money. That's basically it.
You have to require them that they can't close it down, right? You have to actually stop them, because we know that in, say, Niagara, for example, the empire builders in those hospitals have always wanted to close the hospitals in the southern tier. That's been going on for ever since amalgamation in 1998. And in this hospital corporation, it's the same thing. The ones that are seriously in trouble are the ones where they have for a long time wanted to shut them down. It's a question of setting a standard and policy, requiring them to keep them open, and then, like every other hospital in the province, they find ways to actually find the staff to keep the hospitals open. I mean, every hospital where they've tried to close it, in my experience, they've always said it was a staffing issue, and every time the minister intervened and said you have to keep it open, miraculously they found the staff. So it is, yes, funding. I mean, obviously last year's funding was outrageous given the situation, but funding and the resources and all of the things that there were 48 recommendations, I think, in Chesley to support the staffing of that emergency department. I mean, there's all of those recommendations around retention, around treating the employees right, addressing the workload issues, attracting and retaining them. But I mean, bottom line, this is a question of setting a standard and refusing to let them just shut down these services that they've wanted to shut down forever.
Just jump in.
Yeah.
Jeff, I just want to elaborate a little bit in response to your questions about the consequences for the hospital. And they cannot be understated. 10 inpatient beds might not sound a lot. The nearest hospital being 20 or 30 minutes away may not sound like a lot. The length of an entire resuscitation for someone that is in cardiac arrest could easily be less than 20 minutes, number one. Number two, Let's assume that an ambulance needs to transport a patient to the next closest hospital, which is 30 minutes. That ambulance is out of service for 30 minutes to go there, 30 minutes to come back to the community, and the handoff in the emergency department is not instantaneous either. So we're looking at taking an ambulance crew off, realistically for a minimum of 90 minutes. When those 10 inpatient beds go, the physicians that work in that hospital feel that they're not supported and they cannot deliver patient care safely. And so the physicians leave the hospital. And that is what is happening. As both a family doctor, emergency doctor, as the Ontario Liberal health critic, my perspective on the closure of the Durham Hospital is not surprising, obviously. This will cost people their lives. This will cost people their dignity. It will undermine emergency care and critical care. But as some of you know, I don't just wear the healthcare critic hat in the Ontario Liberal Party. I also wear the housing critic hat. And the knock-on consequences of essentially this hospital closing or inevitably closing is that as we speak, there are 2 developments in Durham totaling approximately 500 homes. Those developers are pulling out. In the midst of a housing crisis, this short-sighted healthcare decision, which will cost lives, is also setting us back on the housing crisis. This is a problem. If this government cares about healthcare, they need to act. If they care about housing, they need to act. If they care about rural communities, they need to act. And if they care about northern communities, they need to act. This is a problem for Paul Calandra. This is a problem for Sylvia Jones. It is one for Doug Ford. And if they actually were willing to show any leadership, if they were willing to take any action, we would have heard from them already. Last week, Mayor Eccles and I, we delivered a petition with 3,700 signatures that was accumulated in 48 hours. Then we walked up to the Premier's office and delivered hundreds of letters to the Premier. He didn't see us, but we delivered it to his staff. Radio silence. This is not a government that is willing to take action to protect the interests of rural Ontarians and to defend our healthcare system. And that needs to stop. The ER closures and hospital closures need to stop. We need to preserve, protect, and nurture our universal, publicly funded healthcare system.
Here, here. Thanks for intervening. Anything else?
Just, you mentioned other hospitals at risk. Are there, we know the Minden ones that have happened, but are there others you can mention that we're...
Yeah, we were just talking about Strathroy. Did you want to mention?
No, go ahead.
So Strathroy, it's their pediatrics, right?
Yes.
Chesley is, of course, very, very much at risk.
Yes.
Chesley's in the same amalgamated. No, Strathroy is not. It's west of, the area, but it's in Middlesex, just west of London, south of the 402. There's...
Chesley's in the same one as Durham, yeah.
That's right. The obviously the next ones in line are Fort Erie and Port Colborne, where they're planning where they've closed the urgent care centers overnight and evenings, and they're planning to shut both those hospitals down completely, all the beds, all the services. And Welland, and these are not small communities, right? 40,000, 30,000, 50,000. They serve 100,000 people in Welland. They want to close all of the inpatient acute care services and the emerge department, turn it into an outpatient facility only. I mean, if they get their way in Niagara, everything in the southern tier is going to be gutted and shut down, and there won't be actual hospitals there. I just have to search my list. I'll email you a list of all of that. We've been tracking all the closures.
And the trouble is these amalgamated hospital regions?
The amalgamated hospitals have been for years, ever since amalgamation, more at risk than the non-amalgamated hospitals, for sure. The standalone hospitals are doing better. There are exceptions, like Wingham, for example, but I mean, mostly the amalgamated hospitals are doing much worse, mostly because they'll be, the chief of staff or whatever wants to centralize all the surgeries and have a high volume, what they call center of excellence. I mean, really, the last hospital standing is not a center of excellence. It's just simply the last hospital standing. But that's the ideology that they have, and because, you know, in the years of hospital cuts and the years of underfunding, and Ontario funds its hospitals at the lowest rate of any province in the country, they decide to cut off their appendages to save, you know, the center, and that's the smaller rural sites, and that's what we have. We've seen to centralize the resources, even if it doesn't make any sense for where the patients actually go, which is, you know, the case here.
And it's connected to all these hospitals we've heard about with deficits.
That's right. Well, I mean, last year, like, because of the funding in 2023, virtually every the vast majority, if not every hospital in Ontario, was thrown into deficit at a time with unprecedented closures. Like, what kind of policy, if you're serious that you're doing everything possible to save these hospitals, what kind of policy decision making is that? It's like if you wanted to purposefully run it into the ground to shut it down and privatize it, that's what you would do.
And I think that's
Ms.
exactly
Bracebridge,
what,
sorry.
if I can give you two slight examples.
You want to give it a-
What I've,
Okay.
the first time we were told that the Emerge was going to close down, and that was because of staffing issues and how the management was going to arrange that so that, yep, the Emerge would stay open for 12 hours a day or 10 hours a day, whatever you want to say, and the hospital, yep, would be very good. A few days later, 45 days later, we find out, oh, that's not working. We've got to take the inpatient beds now out. I'm not much of a conspiracy theory, but I can see the conspiracy going on here. It's a staffing shortage. It's a staffing shortage. We can't find staff. Two great examples. The staff, permanent staff in the Durham Hospital 3 weeks ago, all sat down, and it was because we've got to do this by June 3rd so that there's holidays coming up and everything, and with staff, we've got to get these beds transitioned before that so that everybody can have their holidays. The staff in that hospital sat down and worked out a staffing schedule. Management wouldn't even look at it, accept it, or anything. That would have kept the hospital open until Thanksgiving, fully staffed and whatnot, and that was not, it was just tossed out. A week ago Sunday, I'm on a list that when the Durham Hospital's Emerge is closed, yep, I get notification. 6:45 on Sunday for the Durham Hospital, it's closed. Staffing issue. Do a little bit of investigation on it. The nurse was in the Durham Hospital, ready to go to work. I got the notification at 6:45. She was there at 6:30, ready to go, when the doors opened at 7 o'clock. At 6:40, management phoned and said, we've got another problem at one of our sites. We're closing the Durham Emerge. You're going to the other site. End of conversation. Really? And now you tell me it's a staffing issue. I've been fed a little bit too much of that I've been in politics for a long time, and yeah, there's sometimes a little bit of that goes on, but this is just beyond belief. It's been the age-old thing, create a crisis. I think there was a minister one day that said that. Mm-hmm. Create a crisis and then we can management. And this staffing crisis in Durham is definitely being that way. Hanover, 0 closures, 20 minutes away, independent of South Bruce Grey. 0 closures in the last 3 years of their Emerge, of their hospital. Bright Shores, centre out of Owen Sound that has 7 sites in the Grey Bruce area. I can count on one hand in the last 3 years how many times any of their sites have been closed. That's 3 years, one hand, for 7 sites. Is there They've managed to understand. Is there a shortage of staff? Yeah. But they've understood how to do it. What is it that's in behind this? It's not about that. They've created a crisis, I think, as Natalie has said, to close rural hospitals. Thank you.
Thanks. Thanks a lot.